Hello, I'm Dr. Puya Mahadra, and I'm the Director of Spine Intervention here at Cellaxys. Today's topic is causes of popping noise in the lower spine. Cracking or popping sound that result from joint manipulation are commonly considered harmless. However, if a pain is associated with popping, then further workup is necessary. Popping or clicking sounds can sometimes be a sign of possible excessive strain on the joints. Popping is possibly due to the release of gas from the synovial fluid in the joints. Synovial fluid acts as a lubricant and a shock absorber. Popping also heard when tendons move over the joints. The medical term crepitus describes any grinding, cracking, or popping noise when moving a joint. Causes include air bubbles popping inside the joint, which is not typically painful, tendon, ligaments snapping over the joint, this can sometimes cause pain, and finally osteoarthritis of the joint. Osteoarthritis causes articular cartilage to degenerate. This causes pain. Osteoarthritis in the lumbar spine affects the facet joints. Joints have surfaces that are lined with smooth cartilage to allow better movement and less friction. If the cartilage is damaged, then the joint moves and then pain ensues. There is an inflammatory response which can also cause pain. Each of the facet joints is innervated by a nerve called the medial branch nerve. Joints are also very small and susceptible to damage. Torn and damaged discs can also cause facet damage when the weight-bearing disc no longer can handle the stress and it gets transferred to the facet joints themselves. Signs and symptoms include back popping, back pain, back stiffness, occasionally numbness, tingling, and weakness due to spinal stenosis, which means narrowing of the spinal canal. Swelling from the facet joints rubbing against one another causes inflammation, which can also lead to pain. Diagnosis is typically made with imaging such as x-rays, CT, MRI, and obviously physical examination. Treatment options include over-the-counter medications, physical therapy, steroids. And here at Cellaxys, we offer regenerative medicine as an option. We have two modalities that we utilize. One is PRP, which is platelet-rich plasma. The patient comes in, we obtain about 50 cc's of their own blood, and then that is spun down and then eventually injected into the specific joints. The second option includes bone marrow aspirate concentrate, which is obtained from the patient's iliac crest. We obtain approximately 50 cc's of bone marrow, which is spun down and mixed with PRP, then injected into the facet joints. Please schedule an initial consult to see what options are available. Thank you for watching, and I hope this was informative.